I'm Katrina Jameson. I am the Senior Director of Operations at Equiscript in Charleston, South Carolina.
My name is Maurice Alexander. I am currently the Clinical Manager for Hematology and Oncology Clinical Pharmacy Services at the UNC Medical Center.
I'm Donald Harvey, PharmD. I'm a professor of hematology and medical oncology, as well as pharmacology and chemical biology at the Emory University School of Medicine in Atlanta. I'm also director of the Phase 1 Clinical Trials Program in Cancer Research here.
Hi, my name is Kimberly Brown. I'm currently a National Field Director at Janssen Infectious Diseases, which is one of the pharmaceutical companies of Johnson & Johnson.
I graduated from the UNC Eshelman School of Pharmacy with my Doctor of Pharmacy in 2010.
I graduated in 2006 with a PharmD.
I graduated from UNC in 1994 with a BS degree, and in 1996 with a PharmD degree, and then completed 2 years of residency, the second of which was in hematology and oncology at UNC.
And I'm a 2000 graduate of the UNC School of Pharmacy. With respect to my daily roles and responsibilities as the National Field Director, I'm responsible for the overall medical strategy for our field teams. So this basically works with the in-house team to devise the strategy and to ensure proper dissemination of our data, as well as competitor information and understanding that to our MSL as well as our community liaison team.
I practiced clinically for a few years within our oncology team, specifically in our bone marrow transplant group. And in that role, my day-to-day involved educating bone marrow transplant patients about the transplant process, but also helping to manage some of the complications that we see following a bone marrow transplant. After about 7 or 8 years in clinical practice, I transitioned into my current role as clinical manager. And in this position, I have the privilege of leading an amazing team of clinical oncology pharmacists that manage patients with various types of cancer.
You know, my day-to-day is pretty simple. I spend a large amount of time in meetings. Not because I love meetings necessarily, but because I spend the bulk of my time mentoring, teaching and training, helping other people understand what good judgment looks like, how to improve a business process, how to create a flow in order to improve efficiencies. So whenever I do all of those things, at the end of the day, what results in that is better care for the patient. And so the patient is number one, and then we improve the business behind it in order to better serve them. So that's a day in the life of operations.
On a daily basis, I work with great physician colleagues and other researchers here, as well as patients, to run the program. I write protocols, I conduct research, I write grants, and certainly try to publish as much as we can our results. But most importantly, I really love the patient interaction. It's critical to what we do, and I think we are incredibly lucky to have the patients we have.
I've always thought oncology to be one of the most innovative areas of medicine. But I also think that the oncology patient is a very complex patient with complex needs that the oncology pharmacist is uniquely positioned to meet when it comes to managing their chemotherapy and some of the supportive care therapies that we use.
I chose oncology primarily because of the great foundation and mentors I had at UNC, and also because I recognized that the world of cancer therapeutics could only get better throughout my career. And while I feel like we've come a long way in drug development in cancer, we certainly have a very long way to go.
I chose this area of practice as I wanted to have greater impact. While I was able to impact individuals on a daily basis by taking care of them within our HIV and hepatitis C clinics, I saw that there was so much more work to do and wanted to have national impact or even international impact.
I have spent my entire career in pharmacy operations. I absolutely love it. You know, the reason why I went into pharmacy is to improve a patient's life, improve their healthcare outcomes, right? I know a bulk of you have done that as well. But for me in pharmacy operations, I get to do that not one patient at a time, but one business at a time. You know, one person at a time. I go in and train other pharmacists. I train operators. I train business leaders. And through my influence, teaching and training and guidance and improvement of efficiencies and processes, instead of taking care of one patient at a time, I can take care of hundreds at a time. And so that impact that I want to have on the world and on patient care is expanded, you know, so many times over. And so I love that. I love taking care of my peers so that they can then turn and take care of the patient. And that's really what operations is all about.